In this video, we'll discuss about lupus erythematosus. Uh, to understand it first, you must know that there are two types. One is the SLE type and one is the DLE type. SLE is the systemic lupus erythematosus and DLE is the discoid. Okay, so in this video, we'll definitely talk about systemic first and then about the discoid. All right, so as the name suggests, it is basically pertaining to systemic manifestations. So coming on to the definition, it is the autoimmune disease characterized by autoantibodies, immune complexes, also immune dysregulation resulting in damage to essentially any organ in body. Example: heart, kidneys, lungs, joints, etc. All right, now why is it called as lupus? Now the meaning of lupus is actually wolf. So the rash which is formed due to lupus erythematosus, it is resembling a wolf's bite. So that's why it is called as lupus erythematosus. Okay, coming on to the etiology, it can be due to genetics. I'll make you understand it in the pathogenesis. Also due to some environmental causes. Basically, what we see is because of the UV radiations, they act as a flare up for the lupus erythematosus. Also, because of the hormones. Very important. Now, this will help you to remember the predilection. Estrogen is mainly responsible. So, lupus erythematosus, this makes it clear that lupus erythematosus will be seen more in females. All right, this is quite clear. Then, it can be caused due to EBV, Epstein-Barr virus, also due to some medications like hydralazine, isoniazid. Now, coming on to the pathogenesis, first I'll just give you an overview. Okay. Yeah, first we'll draw the diagram, right? So, coming on to the diagram, I'll make it here. Yeah. So, let's discuss about the pathogenesis. Okay. Now, be attentive. Suppose you have this. Let me take a pencil. Yeah. Yeah. So, let's consider. So, suppose this is a normal cell. All right. So, this we have is what we have is a cell. Now, what happens is in this cell the DNA, it gets damaged. Okay, now if suppose in a cell, normal cell, the DNA gets damaged, so what do we expect? The cell to undergo apoptosis, right? So we will expect it to undergo apoptosis. So this is basically a apoptotic cell. All right, now how will it go apoptosis? Is through opsonization, right? We know it. Macrophages and monocytes. Okay, so basically it will undergo programmed cell death with a lot of fragments of DNA. All right, this is clear. Now suppose if it does not happen like that, it is not cleared effectively. Why would it happen? um, to understand this, let me tell you something. um, Now normally what really happens is, this is our apoptotic cell and this is the macrophage. All right, now complement opsonization occurs. You know it. We studied it in general pathology. Immune response complement proteins will surround it and then this will get attached to it, right? So there will be complement proteins, these, right? Now, but this is normal. But in SLE, what you will see is there is deficiency of complement proteins. So no opsonization will occur. genetic deficiency. So that is why I mentioned it in the etiology. All right, this is clear. Now what will happen is, now it is not cleared effectively. What we will see is that the nuclear proteins, basically the DNA, right, it will start coming out. Okay, now all right, and the antigen presenting cell, it is going to act as if it is immature. It will be immature APC. All right, now what you will see is that the internal proteins, they will also start acting, being projecting on the cell membrane. Now let me talk to you about what all proteins are there that I'm talking about, right? The first one being the nuclear protein, then the cytoplasmic protein, and then the cell membrane. Now in nuclear protein, remember there is double-stranded DNA. So you will have histones, SM. In this you will have rho. In this we will have cardiolipin and platelets. Okay. Now what will happen is, one of the proteins, it will act over here. Okay, it will basically get binded. Now due to this happening here, what you will see is that this antigen presenting cell, this will lead to the formation of an immune complex basically. All right, due to this complex, what you will see is there will be an humoral response. Okay, now humoral response, now why what will happen if humoral response occurs? We will see that the plasma cell, okay, this is the B cell, then the plasma cell, what it will do is it will start producing antibodies. Now what will happen is, the main thing that really happens is, suppose this is our complement, this is the cell that is defective. All right, apoptotic cell. All right, and then we have some antibodies which are being produced by the plasma cell. Now these will go out and these will bind here. Now this is an immune complex formation. This will lead to a complement system activation. Now this complement system activation plus cytokine release, what is this? This is inflammation. So this covers the pathogenesis. All right, I hope you understood. I'll make it clear once again. We had a cell which had damaged DNA. Then apoptosis did not get effectively performed, due to which there are some nucleoproteins, they are going on to the out the cell surface, in the cell surface. Okay, then you need to know these. This is very important because in investigations we will have to look on to these proteins. Then immature APC, then immune complex formation will occur like this. This is the last step. Okay, this is the pathogenesis in very short term. Now I'll just once again put it in a view that you can actually screenshot it, so that it is easy. Give me a So we have covered the pathogenesis. Now let's talk about the age epidemiology. Now in age, it is usually seen in 30 years of age. Now I mentioned in the etiology about hormones, so it is will be more in females. We mentioned about this in the definition, so just write it again. Now let's discuss about the clinical features, right? So for the clinical features, I will be drawing. So first of all, in neurological, then pulmonary, oral manifestations, CVS, renal, bone, blood. All right, kidney is done, abdomen, um, yes. So now let's talk about it. In neurological, what you will see is, you will see impairment of consciousness, seizures, headache, psychosis, and peripheral neuropathy. Now, what is this? This is basically the butterfly shaped rash which will be formed. Now, the eyes, they are highly photosensitive. So, UV radiation acts as one of the precipitating factors. So, right, then coming on to the oral manifestations. In oral manifestations, you must remember that there is an increased chance of bleeding. There is superimposed oral candidiasis. Also, lupus scolitis is very common in the lower lip. Now, in case of CVS, what we will see is we will see pericarditis, we will see myositis, and pleural effusion. In case of kidney, you will see that there is going to be lupus nephritis. Now, a very important keyword that you must mention here is actually the wire pattern, characteristic wire loops in kidney. Also, renal failure. Okay, this is very important. Don't forget to mention it. And this also this. All right. Yeah. Then in the bone, what you will see in bone, you will see that there is going to be osteoarthritis, osteoporosis in 90% cases. Then there is increased frequency of fracture, right? Then in blood, you will see that there is going to be anemia. Also, there is going to be leukopenia. Now, why did I draw this? This is to demonstrate that the person will have hypertension. Okay. Now, in abdomen, what you will see is you will see hepatomegaly and abdominal serositis. Now, in the pulmonary, we will have the interstitial fibrosis, pulmonary vasculitis, also pleural effusion and pleurisy. Okay, this is clear. Now we've covered almost all. Yes, I'll just mark the important ones. Interstitial fibrosis, hepatomegaly, anemia, leukopenia, osteoarthritis, osteoporosis, pericarditis, myocarditis, bleeding, superimposed impairment of consciousness, peripheral neuropathy, and this is photosensitive. All right, and lupus nephritis. So this basically covers the clinical features and the oral manifestations as well. Now coming on to the histopathology. Now in histopathology, what you will see is in liver, there is going to be hyper orthokeratosis or parakeratosis, acantholysis, then pseudoepitheliomatous hyperplasia, then hydropic degeneration and liquefactive necrosis of basal layer, then thickening of basement membrane, inflammatory cell infiltrate. Then you can also see small perivascular collection of lymphocytes. So after this, we will discuss about the lab findings. So in lab findings, first blood anemia, leukopenia, then ESR is raised, CRP is raised. Then we will do the blood chemistry. Also, we will do, even if we do the IF, direct immunofluorescence, we will see GAM antibodies, autoantibodies. Then very important, I told you to remember all the nuclear proteins, all of their tests, in that is ANA tests. Also, there is one test which is lupus band test. This is also done. Then in treatment, what we will do is there is actually evaluation done and the medical regimen is performed, and systemic steroid therapy is given. But however, you can remember this for a short term base. This is basically the whole mechanism, and in this what you will see is this is going to be stimulated by IL-2. Now, due to inhibit this, we will use tacrolimus. Now, this is mycophenolate and azathioprine. Now, what are these? These are actually the immunosuppressive drugs, right? So for inflammation, glucosteroids and acids, and for the this B cell being stimulated, we will give belimumab. Basically, we are inhibiting the production of antibodies. So this completes the lecture. I hope you understood. Thanks for watching.